All right, Dr. Baha, whenever you're ready, we can start.
Yeah, can you tell me the station again? We are doing headache, right? GB.
Yeah,
Headache
we're
and
doing
GB.
headache. Yes, we're headache. Not injury, but we're doing headache today. And
Yeah.
this person
NGB, I
is
mean.
in the, yeah, okay. He is in the
Okay.
accident and emergency department. And this person, let's say he is 66. All right, 66. And let's just change his name.
Subarachnoid hemorrhage. Okay, ba?
No, not really. It could be anything, right? Okay,
Yeah.
66. He's an accident emergency. And what do you want me to name him, Dr. Baha?
Donald Trump.
Donald Trump.
Subarachnoid.
Okay, I'll just call him Trump. Okay, good.
Okay.
All right. Okay, whenever you're ready, Dr. Baha.
66 headache in A&E.
Yes.
Okay.
Okay, give me a minute.
Okay.
I'll just be starting the timer. Just a minute.
My name is Baha bin Ahmeda, DMC number 771605. Good morning, I'm Dr. bin Ahmeda. I'm one of the junior doctors working here today. Can I confirm your full name and age, please?
Yes, doctor, my name is Donald Trump and I'm 66 years old.
66. Okay, and what brought you to the hospital today?
Well, doctor, I've been having a bad headache. It's really, really bad. It really hurts me.
Okay.
It's something I can't tolerate.
I see. Are you comfortable to talk at the moment?
No, doctor, I don't feel like talking. I just want to get done with this.
Yeah, I will make sure that I don't take a lot of time. Okay, so I would like to ask you a couple of questions, to get a better picture or a better understanding of your headache, if you don't mind.
Yeah, doctor, please. I mean, just make it quick.
Yes. So can you tell me a bit more about the headache?
Well, doctor, it's been there for around 3 days now, but now it's got worse, and I don't like sitting in this light. Can you turn it off a little? It's hurting my eyes. Can you dim this for me?
Yeah. Yes, I can do that. Yeah. Okay.
And I'm also having fever off and on, and I kind of feel cold. So this is a really bad headache.
Okay, and you've mentioned that the headache is getting worse within the past 3 days. You also feel cold, and what else? You also have some sort of fever.
Yeah.
Okay, and apart from this, is there anything else?
Well, yeah, I've kind of vomited, and and I feel a little sick.
I see. Okay, and to have a better look or a better understanding of this headache, can you tell me, like, have you noticed anything that can make this headache worse?
I don't know. I mean, no, nothing like that. But I just when I sit in the light, it kind of makes me feel bad.
I see. Okay, and what about have you taken anything to make it better?
Well, doctor, no, I took this paracetamol, but it didn't work out for me. No.
Didn't work out. How much did you take?
I took 2 tablets the day before, and today I took another one, but it didn't help me much.
Didn't help. Okay, and if you can score the headache for me from 1 to 10, 1 being very mild headache and 10 is the severe headache that you ever had, can you score it for me?
Well, it's going to be around 9. It's really, really bad.
I see. I can see that you're a bit distressed, and I will try to not take a lot of time here, and we can start with our management. Is that okay?
Yeah, please go ahead.
Okay, so Mr. Donald, if I may ask, like, apart from this headache, you also mentioned that you're vomited. Can you tell me how many times did you vomit?
Well, yes, doctor, I vomited around 3 times, and it was all that I ate just came out, and I haven't been eating well as well because of this headache, and I just want to sleep.
I see, I see. And have you noticed like you had these vomiting early in the morning
No, 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 not in the morning.
throughout the day then?
Yeah, almost.
Oh, by any chance, have you had like any recent trauma to the head or recent falls?
No, doctor.
Mm-hmm. Any by any chance, like, come on, like by any chance, have you had like any chest pain or any difficulty in breathing?
No, doctor, no.
Mm, okay. And how's your general health, Mr. Donald? Like, are you diagnosed with any long-term conditions?
No, doctor.
That's good. Are you taking any regular medications or over the counter?
No, doctor.
So no
I
blood
do
thinners.
take, yeah, I have been taking them. My family physician, she's
Mm,
my friend, right?
okay.
She's from the country where I'm from. She said that
Mhm,
generally they do take aspirin, so I've been taking it. Though I have no
mm.
other medication, like I don't have any disease.
Okay, and for how long you've been taking aspirin?
Oh, it's been around 2, 3 years. Yeah.
2, 3 years. Okay, can you tell me the dose?
I don't remember. I just take 1 or 2 small tablets, right? Not regularly, just off and on
Mm,
whenever I remember him.
I see. Okay. And regarding your lifestyle and habits, Mr. Donald, if I may ask, do you smoke?
No, I don't.
Do you drink alcohol?
No, no, I'm not an alcoholic.
Okay. And what about, any unexpected recent weight loss?
No, I haven't lost any weight.
Any lumps or bumps anywhere?
No, doctor.
What about, any family history of similar headaches or kidney problems?
Well, no, not really.
I see. Okay, so Mr. Donald, if I may ask, like, have you given any thoughts what might be the cause of this headache?
I don't know, doctor. I've been having this fever, this vomiting, and I have no idea. I have no clue. I just feel like I want to get better soon, and this headache is killing me.
What about, any worries or any concerns about, from the headache?
I don't know. I just don't want to die because my great uncle, he used to have these headaches and he died of it, and I just don't want to die.
Yeah, it's a valid concern, and I'm very sorry about your great uncle. So thank you very much for answering my questions, Mr. Donald. For now, I would like to examine you. I'll be checking your observations, as well as doing a neurological or examining the nerve. Would that be okay?
Yeah, doctor, please go ahead.
Okay, so just to summarize, Mr. Donald, you've mentioned that you had this severe headache for the past 3 days with vomiting. You also mentioned that you've been feeling hot. So I would like to run a couple of investigations, doing some blood tests, including full blood count, checking your liver and kidney function. Would that be okay?
Yeah, doctor.
Yes. And for now, yes,
Mhm.
yes.
The lymphocytes are high. The lymphocytes are high, and the neutrophils are also high. And he's got. Did you do the examination? No, I don't think so.
Okay. So for now, Mr. Donald, your test results came out. There's some sort of increasing in the white blood cells, and to be honest, I'm not quite sure why you had this headache, but because you are having like severe pain, so I would like to start you with painkillers right away to ease your pain. Would that be okay?
Yeah, doctor, please.
Yes, I will be talking to my senior. He might come and reassess you again. But for now, I would like to keep you in the hospital to make sure you're okay. How's that sound?
Okay, doctor. All right.
Yes, well, since you've mentioned that you have a severe headache, so it's better that we keep you here, and we also might involve the specialist. Yeah.
All
What is
right,
the
doctor.
diagnosis?
The time's up. You
Okay,
tell me.
fever, headache, fever,
Yeah. Mhm. Vomiting, neck
and vomit.
stiffness, doesn't want to sit in the light. What is it?
Meningitis.
Yeah.
Yes, and the white blood cells are high.
Yeah. You know one thing, you were
Clear.
going towards subarachnoid hemorrhage and meningitis. And one thing would have made a difference if you asked about the rash.
Oh
Maybe
my
about the rash.
God.
Yeah,
I was gonna, I
just
was
the
going
rash.
to ask about it, but I said like meningitis. Come on, 66.
So what? They
Oh,
cannot have meningitis. Are they not allowed to have it? I think they can. No? And Trump should
yeah,
have
yeah,
it. He's a nasty
yeah.
guy. He can have it, all
You
right?
know,
You said
because
Trump. I was gonna make it
no,
subarachnoid hemorrhage, but then you said the word Trump. I was like, okay, meningitis it is.
oh my God. Yeah.
Don't worry, Dr. Baha, you did good. You did good.
No,
You
because
did good.
I have this misconception, meningitis pediatric, meningitis pediatric. So
Yeah, that's true.
didn't,
Hmm.
my bad.
So no, that's all right. Just one thing, if you would have even asked the vitals, you didn't do the vitals or the examination. Did you do that?
Yeah, I said I'm going to measure your observations and do
Okay,
neurological
so
examination.
I'm sorry I didn't hear that. If you would have said that, I would have told you his oxygen saturation is low, and
Mm.
his BP is kind of low too because he's been vomiting. Then if you wanted to manage him, you could have given them all the things, right? Like oxygen, painkiller for this headache, and then you're going to give him fluids, right? And what else
Mm.
is there? There's a fourth thing as well. What else is
Yeah,
there?
fluids.
Antibiotics,
You mentioned
painkiller,
antibiotics.
oxygen, fluid. Yeah.
Yes.
Yes.
Okay. And antibiotic, you also tell him that you'll be involving your seniors and they might start him on antibiotics, huh?
Yes,
Yes.
yeah,
Yes.
Mm.
exactly. Yeah.
Don't worry, Dr. Val, you did a good history. Just you missed on the rash thing. That's all right.
Yes,
But
and
that's
for
good
this
that
No,
one,
you
you
found it.
because meningitis didn't cross my mind. To be honest, I was going to ask about rash, but didn't see the relation here. So
No,
if
you see,
if I asked it
yeah,
and
I
you said
mean,
yes,
if
then
Mhm. Mm.
that made it a
So,
lot
so
better
see
for me.
this person. Now you see, if the person comes with a headache, and then he says that he doesn't like the lights, turn it off. There could be three things, right? I think there could be three things at the most. Number one, meningitis. Number two, he could have subarachnoid hemorrhage. Number three, he could have migraine, right? I don't think in cluster they'd want you to turn the light off because in cluster the pain is so bad they just want to pace around the room. So if you get to know the and I guess you didn't do the Socrates very well because you didn't. I did say it was for 3 days, but you didn't ask where it was and the
Mm,
character, right? And the pain scale you
yeah.
did, and he said it was 10 on 10. So it could either be subarachnoid hemorrhage or meningitis. And when you asked the questions and you wanted it to be either the subarachnoid hemorrhage or the meningitis, so how do we differentiate? I mean, both of them could have fever, both of them could have vomiting, both of them could have meningitis, right? This the symptoms of meningism, right? Both of them, a person would be shying away from light. But in subarachnoid hemorrhage, the person would not have a fever, not most likely, right? He wouldn't have a fever and he wouldn't have a rash. So that way, we could just say that, no, sorry, in subarachnoid hemorrhage, you wouldn't have the fever and the rash. So if that's the case, then we can just, come up and say, it is meningitis. And we're almost right, right? And one thing is that don't say, I don't know what you have. You could say it could be a couple of things, right? We're thinking a couple of
Mm.
things, but we're going to run more tests, right? Don't lose confidence. That's the whole thing, because we are junior doctors there, and we don't really know that how exactly are we going to are we supposed to get to the bottom of it. So instead of just saying that I don't know what it is, how about you show them that you're a safe doctor, you're a responsible doctor, you're a good doctor. Good doctor meaning that you have the knowledge to deal with the patient and turn out to be professional, right? A professional person wouldn't say, I don't know what's going on, right? It's good to be honest, but you could say that at the moment we're not very sure what it might be, but it could be a couple of things. At the worst, it could be a thing called a thing where there could be bleeding in your head, what we called as a subarachnoid hemorrhage. I hope you're following.
Mm.
And like it could also be meningitis, but I'd be involved with my senior, would be discussing your case, and I hope this is all right. And then would be admitting you for now because you have high white cell count, and we would be isolating you, right? If you thought it was meningitis, you know what to do. But like don't tell them that you don't know it, right? Don't tell the patient, because that way the patient, if you, for example, you are a patient and I am a junior doctor, I look young, and I'm just dealing with you in the emergency. If you tell me I don't know, the patient would be like, I have a headache 10 on 10. This doctor wasted my time. He said that he's asked me so many questions and he doesn't even know what's wrong with me. So you could say I have a couple of things, right? This could be a couple of things. That's what I want to say here, Dr. Ba. I hope that's all right. Yeah.
Yeah, thank you very much.
No worries. I hope I didn't speak much.
Not my day. That's all.
No, don't say that. You did good. Why did you say that? Your IPS was good, your history taken was good, your management was good. Just because you missed the
Yeah, okay.
diagnosis doesn't mean that you didn't do good. Why did you say that?
Yeah. Okay. Another question. If you know, like at the beginning in the station when you asked me to turn off the light, does this usually happen in the real exam?
Well, I've got some friends, and they took their exam, and they did say that they had these stations, and it could be right because of the patients in a pain, right, and they are
Yeah.
in the emergency, and we
Could
have our
you?
curtains, right? We do have curtains, we have individual lights, so they can ask you to, because if it
Okay.
hurts
So
them, it hurts them.
should I like assume to turn off the light and continue?
I guess that's about it. If he asks you to, right? Like we are not offering him, right? Right? We're not
Mm.
offering him. But if he asks you to, then fine, because it's not what you did. They asked you. So it's on the patient, not on you, right? I hope
Yes.
that makes sense,
Yeah.
right?
Yes. Yeah. Thank you, doctor.
No worries, Dr. Vaha. You did good. All right, you did amazing. Okay. Anybody else who wants to take part in this and be the doctor? Because I want to be the patient if anybody's interested. Or yes, Dr. Hamza, do you want to do this station? Okay. So first, Dr. Hamza and yes, first Dr. Hamza and then Dr. Hadi. All right. Is that okay? Dr. Hamza, are you there?
Yes, doctor, I'm here.
Okay. Whenever you're ready.
Okay, but I cannot see the question.
Let's see the question. The screen's been shared. Can
Yeah,
you
I
see
can
it?
see just one thing on the screen, which is alphabets, acute, chronic, Trump.
Okay. Okay, you can't see this. Okay, I'm just gonna, write over here. So this person, can you see this?
A&E. Yeah.
Okay, so this person is in the A&E. Okay, and this person is, let's say, 45 years old.
Doctor, can you
Is
just got
Lisa?
hello, doctor? I'm sorry, I
Yes,
got
Dr. Rowan,
disconnected.
how are you? No worries.
I got disconnected when you were saying the questions that should be asked without wasting time. You said that we should ask the questions, some questions in a way that we don't waste time, and then I got disconnected.
About what, Dr. Rowan? I don't know when you
The
got disconnected.
headache. This like 1 minute ago.
1 minute ago? Okay, I guess you were talking about how to differentiate between meningitis and subarachnoid hemorrhage. Is that where you lost the connection?
Yes, and then you said that there are a couple of questions that we can ask in order not to waste time and to ask our differentials.
Yeah, so like we could just, if it's like if the person is coming with a headache and they said that they don't want the lights there, and they say that they've got a fever, so we're assuming one or two three things basically, right? If they're having this headache when they've got some rigidity, or maybe they don't want the lights there, so there are three things we're thinking. Number one, meningitis. Number two, subarachnoid hemorrhage, and it could be SOL but not really, right? And the third thing is your migraine. So we just see if that's a chronic headache, then it's obviously migraine. This migraine can present as acute, but then we have to like go into dig in the history. But for us to differentiate between subarachnoid hemorrhage and the meningitis, we could ask them about the fever and the rash. In subarachnoid hemorrhage, a person would have meningism, they would vomit, they would have they shy away from light, right? They can have meningism and all of these things, but they wouldn't have a rash, they wouldn't have a fever. They could have a fever, but they would most definitely not have a rash. And when we're doing the blood workup, right, we could just ask them that
Okay.
about the vitals, and that way we'd get to it. I hope this
Yeah,
is
yeah,
what
yeah.
you. Okay,
Yes. Thank you so much.
no worries. Dr. Hamza, are you there? Should we start? This is Lisa.
Yes, we can start.
75 years, she's 45 years old. She's in the accident emergency and she has a headache.
So the setting is accident and emergency. 45 years old Lisa, presenting with headache.
Yes. Yes.
Okay.
Whenever you're ready.
Okay, I'm ready. Yeah.
Okay.
Hamza Khan, GMC number 12345667. Hello.
Hello, doctor.
I'm Hamza, one of the doctors working here. Can I confirm your name and age, please?
Yes, doctor, my name is Lisa Smith, and I'm 45 years old.
What would you like me to call you?
You can call me Lisa.
And Lisa, how can I help you?
Well, doctor, I'm having this headache, and it's been there for around 3, 4 days.
I'm really sorry to hear that, but you're here, so we're going to do the best for you. Is it all okay?
Yeah, I hope so.
So, yeah, so please tell me, where exactly do you have this headache?
Well, doctor, it's just it's around the eyes and the forehead. Like just in the front of my head. Yeah.
Okay, is it both the eyes?
Oh yeah, sometimes, but right now it's my left eye.
More towards the left eye, right?
Yeah, more towards the left eye. Yes.
Okay, and did it start suddenly or gradually?
Well, it's been there for 3 days. It wasn't sudden. I mean, I think it's built on, and today it's kind of not good, and I feel a little sick, so I thought that I should come and see you.
Yeah, you did the right thing to come and see us. So does the pain stay there all the time or does it comes and goes?
Well, I've noticed that it just comes and goes, but almost there all the time, almost all the time.
Okay, and what were you doing when it started?
Well, doctor, I was just sitting, and I don't actually remember, to be honest.
No problem with that. Does the pain go anywhere from your left eye or your head from to somewhere else?
No, doctor.
Have you noticed anything which makes it worse or makes it better?
Yeah, when I kind of lean forward, it kind of makes it better. That's what I've heard. Just yesterday I was picking up my daughter's doll, and I felt like it was some relief. Yeah.
All right. And what kind of pain is it?
I don't know, doctor. It's like there's I can't just say it. It's like something's fluctuating, and I've also noticed that I'm having this bad toothache. Yeah,
I'm sorry, can you please repeat that?
toothache.
Bad what?
Like my left tooth, my left incisor. It kind of hurts. Yeah.
Toothache. Okay, okay. Thank you. So on a scale of 1 to 10, where 1 is the no pain and 10 is the worst pain, how would you rate your pain?
It's around 5, 6. Yeah.
Are you comfortable right now?
Yeah.
So do you have any idea what might be triggering your headache?
I'm not sure, doctor. I had a flu like around 3 days ago. I don't know if that's the reason. I've never had this before, though.
Okay, do you have any discharge from your eyes? Any of your eye?
No, doctor.
Do you have this headache in the past as well?
No, this is the first time.
Did you hurt your eye or your head?
No, doctor.
Do you have any pain or do you have any weakness or numbness in any of your limbs?
No, doctor.
Any problem with your balance?
No, doctor.
Does light or sound bother you?
No, doctor.
Any stiffness in your neck?
No, doctor.
Any rash on your body?
No, doctor.
Did you feel sick?
Yeah, I feel really sick, and I also have a blocked nose. I don't know if that's relevant.
Did you vomit?
No, doctor.
Yeah, whatever you're answering, I'm really I can tell you that all this information is really relevant, Lisa. So do you okay, apart from this, do you want to share anything else with me?
Well, no, doctor. I feel like I also can't smell these perfumes. Yeah, I don't know. I mean, I apply my favorite
Don't
perfume in the
worry.
morning.
Well,
I
don't
can't
worry, we'll
really
find
smell
out.
them.
Yeah. So
Yeah.
is there anything which is particularly worrying you about this headache?
Not sure, but I want it to go away. Like it hurts kind of, and
Hmm.
I don't want it to be there.
How has it affected your life, if I ask?
Not much. I can do everything almost. Yeah.
Okay. And is your eye red?
No.
Okay. So do you take any medicine or any supplement?
Yeah, I take over-the-counter vitamins, and I also am using contraceptives, COCBs. Yeah.
OCPs. Okay. So before the headache, do you have anything in particular? Do you notice anything in particular before this headache starts?
No, doctor.
Are you allergic to anything?
Yeah, I'm allergic to, roses.
All right. So at this few lifestyle question, Lisa, do you smoke?
Yeah, I do smoke. Yes.
Do you drink?
Well, no, I don't drink, doctor.
By any chance, do you use any recreational drugs?
No, doctor.
Okay. So at this point, Lisa, I would like to check your observation, examine the back of your eye, and have a look at the nerves of your head. Will that be okay with you?
Yes, doctor.
Okay. So from what you've been telling me, I think um, you have a condition, we call it as sinusitis. It's basically inflammation of the sinuses of the nose
Mm.
and the head.
Mhm.
Do you know what is sinus?
No, doctor, but I don't really want to know. Am I going to die?
No, no, no. What makes you worried about it? I mean, what made you think like that?
Well, my mom, she used to have it, and she had this headache, and all of a sudden she died. So I'm kind of worried.
I'm really sorry for what happened, for the loss and for what happened with your mother. But this is, it doesn't look serious since you said you don't have any morning headache or you don't have any weakness, any problem with the balance. But if you're still worried, I could ask my senior and we could do some further tests like CT scan of the head
That'll be good.
to rule out.
That, that'll be great.
Okay, yeah, that's great. Apart from this, do you have any other expectation before I prescribe you the pain medicine?
No, doctor. I don't know. I mean, maybe, I don't want to have this in the future. So, anything that'll help me not having this in the future, that'll be appreciated.
Yeah, so to prevent it in the future, what we can offer you is the flu vaccine so that you don't really have sinusitis again. Would you like to try that?
Okay. All right.
And please keep hydrated. There are a few things which you can do, like keeping yourself well hydrated and
Mhm.
mm, stop picking your nose if you do that.
No, I
And
don't do that, doctor. No, no, no.
okay, that's great.
Okay, Dr. Hamza. Yeah. The time's up.
Okay.
How did you did good, Dr. Hamza? You did really, really good. Even if it wasn't like if you missed on things, that's all right. But your IPS was really, really good. Your IPS, as far as I'm concerned, it was really good. Uh, just one thing is that like when you begin the station, make sure that it's open-ended, right? You ask questions which are open-ended, right? Like just start with open-ended questions, right? You directly just started and it wasn't kind of open-ended. If you keep it open-ended, then it'll be far better, right? Okay. And okay.
Okay.
And apart from that, like you asked that where you were. Okay, so how is it related to the person having a headache for 3 days?
I'm sorry, what?
Like you asked them that where were you?
Okay, now I asked, what were you doing when the headache started?
Yes, you asked that.
So
So how is it related?
is this what you were asking? You were
Yeah.
asking.
Yeah,
Okay,
what's the reason behind this question? Because I want to know.
because patient might say that I was drinking or I was lacking sleep. So trying to find out any trigger.
I know, like drinking and
Lacking sleep.
lacking of sleep. Okay, sorry, I muted you. I'm sorry. Can you unmute yourself? Sorry. Lacking
Yes.
sleep. But for that, you'd ask them that where you were. Okay, all right. I'm not going to pinpoint, but just don't say that. And that's what I'm saying because it's an acute headache, and if you want to ask that what were you doing, right? That's good, but like have a reason behind it. Then you can if you are leading to that, maybe ask a follow up and say like, were you drinking? If he says no, maybe, like not move there, or maybe you could, like if it doesn't help in answering, then you can say, like, were you drinking? Are you sleeping well? Because if that's a reason behind it, then, you need to maybe just tell the person who's listening, because, it's not just a patient, they're also listening at the back. They want to know that why did you ask this question, right? There should be a reason behind that question. Otherwise, I guess it was good. You did the Socrates well, the scoring well, your IPS was also good, your psychosocial was good. But when you asked them about the smoking, right? Um, and she said, I smoked. You need to ask her, what do you smoke? How much do you smoke? Are you still smoking? Right? Because even though it's not relevant, but I mean, because this is accident and emergency and her pain, you've noticed it's 5 or 6, right? So it's not that worse. You can maybe just dig deep into it a little. And when you ask him questions regarding regarding recreational drugs, right? I think we need to signpost. What about you? What do you think? Should we signpost?
Okay, so signposting would be few lifestyle questions.
Right. See, lifestyle questions is like, drinking, exercise, smoking, and alcohol. But when you're asking about recreational drugs, it goes apart from that, right? Like sometimes we ask, you can say sometimes we ask questions that can help us in identifying the cause of this headache. And sometimes people take drugs, which may be the reason behind it. And if you're asking that, like maybe signpost a little so that he'd know, he'd have a heads up, right? That you're not just accusing them and you're just asking questions regarding it. So signposting regarding and these recreational drugs is good. And also, like the rest of it was good, but like examine the vitals, sinuses, if you're thinking of sinusitis, because I'm sure at the beginning you got to know that this person had sinusitis, right? The management was good. But when you were explaining them the sinusitis, don't ask them what a sinus is, because they're not, like we're not taking their exam and we don't want them to worry. So we could just simply say that, there's a structure in the face, which are called sinuses. Sometimes they're because you had a flu, right? And when they told you that they had a flu, I mean, that is your clue that, you could just say, all right, you had a flu. Can you tell me more about it? When was it? Because that is also part of the presenting complaint, that they had a flu. And that's going to help you. Like, the people who are listening, they want to see if you actively caught onto that, right? You actively caught onto that if they had flu, then when was it? What did they do about it? Do they still have it, right? And if they asked about toothache, you can ask which tooth. If they told you that, they cannot smell things, so you can say what things you can't smell. Like each thing that he tells you, maybe like talk a little about it, because that'll just show that you're concerned, even though your IBS was amazing, right? And when you give them a provisional diagnosis, you could say that, there could be a swelling or inflammation of the sinuses because you had flu. This could be a trigger, and medicine can help sometimes. And when you're managing him, tell them you did good. You told them about the fluids, and you can tell them about the triggers, right? But for you to help him avoid the triggers, you can ask them if they pick the nose. Don't assume that they pick the nose, right? Because I guess these people, these Britishers, and they're very finicky about you asking them things like that, right? They're generally very hygienic. I'm not sure, but like tell them, making an assumption is, I don't think, a good thing. You did good, you did really, really good, but just saying this, right? And that's all from my side. And then you can say, I'm going to refer you to the ENT, and if it doesn't work out, we can give you some decongestants. So that's what I think is what you could have done, right?
Yeah, that's right. Thank you so much.
Okay. All right. I'm sorry. I hope I didn't say much. Right, Dr.
No,
Hamza?
that was good. Yeah.
Okay. All right. Okay. So consider for referral people with acute insight. Yes, Dr. Arshad, if you want to say this, right? Infrequent recurrent episodes, right? Referral to ENT, treatment failure after extended courses of antibiotic, unusual resistant bacteria, anatomic defects causing obstruction, immunocompromised, suspected allergies. If you could say this, then it'll be awesome. I mean, we're just reading it. Okay, all right. Anybody else who wants to do this? Because we still have lots of headaches. Or do you guys want to do it tomorrow? Because I really want some of us. Also, this is a woman, right? She told you she's taken COCPs. Ask about her period. Ask about what kind of COCPs she's taken. Is she pregnant, right? And has she had her pap smear? Because a woman, she is, even though she's 45, she's still in the, pre-menopause, right? So we need to ask these 4 things from her. Okay? Right. Okay. Anybody around who wants to practice or do another station? Causing obstruction. All right. Polyps. Guys, I'm just
This woman is on oral contraceptive pills is irrelevant here, right? It's not related to the headache.
yeah, it's not related to the headache, but if she tells you she's taken oral contraceptives, then it could be, even though she's 45 and she's taking oral contraceptives, then it is kind of that she might have a some stroke sort of thing. So maybe we could just ask her just a little, because she is a female, so we do need to exclude some things because she's in the accident emergency. So maybe we could ask about the pregnancy and pap smear, right, just to make sure.
Actually, when you mention oral contraceptive, I was beginning to think of a migraine. Huh?
Yeah.
So, but later on, I discovered it's actually not important in this station. There is no connection between oral contraceptive and chronic sinusitis.
No, there isn't. I mean, yeah, that's right. You guys are right. Yes. Yes, Dr. Atta. Do you want to do a station? Dr. Raman, do you want to do any station? Anybody else? I cannot hear you, Dr.
Let me try if no one wants to do the patient.
Dr. Abdul Hadi had said that. I'm sorry. Dr. Hadi, are you still here?
Yeah, Dr. Abdul said he wants to know.
After that, Dr. Raman, if you want, we can do you, right?
Who, me?
Yeah, sure, doctor, sure.
Dr. Atta, Dr. Raman.
Yes,
After
sure,
Abdul
sure.
Hadi. Okay, thank you so much. Dr. Hadi, are you there? Can you hear us? Yes, Dr. Hadi, are you there? Okay, I'm not sure. I think he's saying something. Okay, so whenever you're ready, we can start. I cannot hear you, by the way. I think your mic's not on. Okay, your mic's not working. Okay, so maybe you can join from somewhere else. Or maybe we can do this tomorrow because we've got other stations to do too. It's all up to you. If not, Dr. AAA, do you want to practice? Okay, great. Okay, Dr. Aravan, are you still there? No worries, no worries.
Yes, yes. If no one is going to practice, I can do that.
Okay, all right, great. Whenever you're ready, we can start. Let's just change age. She is, let's say, 35. All right. She's still in the accident emergency, and her name is Lisa, and she's got a headache. All right, Dr. Rowan?
Okay, okay. All right, wait. She's in Lisa, 25 years old, in the A&E, and she has a headache,
Yes.
right?
Yes.
Okay. Okay, I can start.
Okay, whenever you're ready, just give me a minute. Let me go through the timer a bit. Just a minute. And timer a bit, and let me just see what I'm going to do, right? Okay. Just a bit. right, Dr. Raman, should we start?
Yes.
Okay, let's start. Okay.
Okay. Hello, I'm Dr.
Hello.
Rawan Atta, one of the doctors here in the A&E. Would you please confirm your name and date of birth for me, please?
Yes, doctor, my name is Lisa, and I was born in March of 1981.
All right. So how can I help you today, Lisa?
Well, doctor, I've been having headache, and it's been there for around 3-4 days now.
All right. Could you tell me more about this headache?
Yes, doctor, I feel kind of upset, and I'm having this headache, and it's not like it doesn't go away, but it's been there off and on, and I noticed that I've got tummy pain as well, and I feel really tired.
Okay, okay. So the tiredness and the tummy pain started with the headache?
Yeah, almost. I mean, I feel, that it's almost with the same and like during the same time.
Okay, okay. Okay, so let's start with the headache first, okay, if you don't mind. Could you
Yeah, sure.
tell me where exactly is the headache?
Well, doctor, it's just, like all over the place. I can't pinpoint.
Okay. And is there anything that makes it worse?
Yeah, no, doctor, I've not noticed anything that makes it worse. But, I also feel, a little anxious at times. Yeah.
Okay, okay. May I ask you why you're feeling anxious?
I don't know, just generally. I'm not really sure why.
Okay, are you are under any particular stress lately?
No, just generally. I don't know. I feel a little anxious.
Okay, okay, we'll get back to this. Okay, okay. So, the pain, the headache that you're having, okay, anything makes it better?
Sometimes when I drink orange juice, it kind of makes it better. But I'm not sure. This is something I've noticed.
Orange juice. Okay, orange juice. Okay. Anything else makes it better?
No, not really.
Okay, okay. Could you rate the pain for me, the headache, from a scale of on a scale from 1 to 10, 1 being the least and 10 being the most severe pain you've ever experienced?
It's gonna be around 5 or 6. Yeah, 5 or 6.
All right, all right. Okay. So, do you have anything else that's concerning you today apart from this headache or the vomiting, the tiredness and the abdominal pain that you're having?
Yes, doctor. I just have this tenderness around my breasts, and that is also there, and this is kind of bothersome.
Okay, okay. So it's also been there 3 days, since 3 days.
Yeah, yeah.
Okay. Is it related to anything, this tenderness?
I'm sorry. Can you say that again?
By any chance, do you feel it's related to anything?
No, I don't know. I don't think so. I mean, but it's just
Okay.
there when I'm having this headache, and what I've noticed is, like usually when I'm about to have my period, that's when I have this breast tenderness.
Yes, yes, yes. Okay, okay. That's a valid point here. Well, okay. So have you had this before, like the headache and all the symptoms? Have you had it before, or is it your first time to have it?
Mm, Well, I had this, last month too.
Okay. And now, and now you are feeling. This is the only time you say you seek medical, you're seeking medical help.
Yeah, I'm just seeking it because, I don't want to have this again and again. Because, I feel like, like really upset, and I'm feeling tired too. And this breast tenderness,
Yeah.
I don't like that. Yeah.
Yeah, I'm so sorry for the way you're feeling. All right, okay. So, have you been diagnosed? Like, how is your general health, Lisa? Have you been diagnosed with any long-term medical conditions?
No, doctor, I think I'm too young for that.
Okay, okay. So, mentioning your periods, do you usually have your periods regularly?
Yeah, almost. Yes.
Yeah. Okay. So, when was the last time you had your periods?
Like today is the 16th. So last month, I guess, 15th, 16th. Yeah, 16th. Yes.
So, right now you're on your period?
No, I'm not. I think it's about to, like happen soon.
About to what? Sorry.
It's about to happen soon. I mean, it usually starts at 16,
Yeah.
today is 13, so it's expected.
Yeah. Yes. Okay. I understand. Okay. And are you? I would be asking you a few questions now that might sound a bit intrusive. Okay. I hope you don't mind that.
Yeah, sure, go ahead.
But it's important for my consultation. So, are you sexually active?
Oh, yeah, I am. Yeah.
Do you have a stable partner?
Yes, I do.
Right. Okay. Now, are you taking any contraceptive on any contraceptive methods? Are you using any contraceptive
Yeah,
method? I mean.
no, he uses the condom, so yeah.
Okay. Oh, right. Okay. So, thank you for answering my questions, Lisa. Right now, I would like to examine you. Okay, and check.
Okay.
I will start by checking your observations and do general physical examination. Okay, and examine the nerves in your head.
Okay.
Okay. Any
Well,
findings?
everything is normal. Everything is normal. Everything is normal.
Yeah, all right. Okay, so from having listened to you, Lisa, and examined you, I'm suspecting that you might be having a condition we call as premenstrual syndrome. Have you heard
What is
about it
that,
before?
doctor? No,
Yes.
doctor.
Okay. So this is basically a condition that happens before the periods, like how you were suspecting. Also, like it's related to your period, and is in fact it could be the symptoms that you're having could be premenstrual syndrome. Some hormonal changes that happen before the period. Usually, this normally happens in all the females, but some females are more sensitive to these hormonal changes than others, and they start developing headache and feel stressed and abdominal pain, and they feel like they're upset. It's like just mood changes due to the hormonal changes that's happening in the menstrual cycle of the female. Are you getting me?
Yeah, I do feel. I understand that. So, is there anything, that we can do to make it better? I mean, I don't want to have this every month because I'm getting periods
Yeah,
every month.
yeah, sure, yes, exactly. So what we'll be doing is we will give you some painkillers, okay, to help you with the pain. Okay, and if you're feeling anxious or like upset, you can try some remedies that we like some relaxation methods that we give to patients when they're stressed. Try to have some walk when you feel like you're upset. Try to engage in any exercises and
Yeah,
like
I do
that.
exercise. I do
That's very good,
exercise.
actually. That's very good. Try to keep it up, and also try to like relax yourself. Do some yoga. Any relaxation techniques can help a lot during this period.
Okay,
Okay,
I'll do that.
yeah. Okay, and if it did not improve or you feel that your condition is worsening or something like that, you can come back to us immediately. We could maybe change your painkiller. We can give you a stronger painkiller. I'll also be involving my senior to see if there's
All right, Dr.
anything
Rahul,
that's
time's up. The time's up.
okay.
You did good. You did good. She did have premenstrual syndrome. You almost asked every question, and you did say you're not going to admit her, but you could have given her, some general things like you could have, like you did talk about exercise, diet. You can also talk about sleep, about stress, right? Because she did say she was stressed, right? She was kind of anxious, even though she didn't say generally. So maybe we could just, like you did good, right? Like maybe we could say that if it doesn't get better, we'd involve a psychologist or a gynecologist, right? And then we can safety net for tension headache. Apart from that, it was good, right? Just one thing is that, you could ask her to keep a diary, right? Just maybe, like to keep a diary to track this so that, she can avoid the things that might lead to it, right? Like
Diary,
even though
period
she,
diary.
yeah, period diary, right? Like to document the symptoms for at least 2 to 3 menstrual cycles, right? And then she can come back.
Yeah.
Even though she's in the accident emergency, then you can just say that, you can go and check up with your GP. And because she doesn't smoke, I think you asked about smoking. Did you ask about smoking?
Actually, no, I did not ask the rest of the days. The diet and the smoking, I did not ask about them.
So maybe you didn't ask about the diet and exercise and smoking, right? So I guess
No.
because the management of the premenstrual syndrome is related to the lifestyle, like we ask her to have a good diet, have a balanced diet, regular exercise, plenty of sleep. So I guess we need to ask that. But you did good. You did
Yes,
good. I'm
yes.
sure you did good. Just the management part, and you did manage time well. You examined her, but also another way, explain them a little bit better, because the part where we start explaining them the provisional diagnosis is where our management starts, right? Because forming a
Yeah.
diagnosis is the part of still the history. So 4 marks are there, and when we start the management, that is a part where they start to counter marks for the 4 marks for management. So explaining the diagnosis in a better way is a good thing, and maybe you could be confident, right? You were saying the right thing. I guess the best way would be to start from anatomy, physiology, and pathology, right? So we could say that normally, right, the anatomy would be that normally a person like during a period, right before that, a woman might have experienced some symptoms because there are hormonal changes, and sometimes a woman, like you said, good, but don't just directly say you have a PMS, right? Like tell her what that is, right? And then just say the term, because they'll save you time.
Mm.
Apart from
Oh,
that,
so
you
you
did
mean
good,
that
Dr. Aslam.
I
Yeah.
start with explaining the condition and then say the term later. That's what you mean?
Yes. Yeah, that's what I'm
Mm.
thinking. I mean,
Yeah,
everybody
yeah,
has
good,
their
good.
own way of doing it, but still,
Yeah.
you did manage time
Mm.
well, you did history good, so it was all good.
Mm.
But also, you can ask about the fact that if she's pregnant, right? Even though she's having PMS, it could be that she's pregnant, no?
I asked
She's
about her last
anxious.
menstrual period, or you mean I should ask about when one is she pregnant? Like, has she done any pregnancy test? You mean?
Yeah, you did ask about the last period, so I'm sorry, my bad. You did ask a question. You did good. I'm sorry, nothing to say. You did good. Okay.
The last menstrual period, yeah, okay. Okay, so I
You did
also did
ask
not
that.
ask about the red flags, the meningitis, and all that. Do I have to ask
That's
because there was
really,
no
yeah, I'm
time?
sorry, I forgot to say that. Yeah, do exclude the other sins so that they know that, you did exclude it, right? Because if she's having a headache, breast tenderness, etc., even though we think it's a PMS, but in order for them to know that we're a safe doctor,
Mm.
we can ask them about, meningitis maybe, right? If she has a fever, sweating, loss of weight intentionally, right? Maybe that. And what else
Yeah,
can we
yeah,
talk
yeah.
about? Yeah, right? Sinusitis, etc., if we want to exclude the acute conditions.
Okay, so
Yeah.
here I have a confusion here. She's not when I asked her about any stress she's facing recently, she said no stress. So it's normal to feel like you are frustrated or anxious before your periods. Like there shouldn't be a specific reason for it, right?
Yeah, there is no reason. This is why we women are
Yeah,
always saying,
hormonal.
like,
Mm.
they say it's that time of the month, right? Even though that's offensive, because there is no reason behind it, right? We get
Yeah.
frustrated, anxious, irritable because there is no reason. It's just the hormones.
Mm.
Yeah.
Yes.
I hope it's not bad to talk about, but it's true. Yeah. Okay.
Thank you
So,
so much,
doctor,
doctor, for giving us this
no worries,
opportunities
doctor.
to practice every time.
No, no,
Thank you.
no worries. So we have to tell all the issues in the part of the diagnosis. For example, if a patient, female coming with headache tells you that she's also taking contraceptive, then you should have connect it somehow. How, Dr. Arshad, how do you want her to connect this? I'm not sure if you're still there.
Yes, sorry. So the thing is that is as Aman Arora explains it, right? That the first half is to dig out what are the issues of the patient, and in the second part, what findings did you get in the history part? You have to tell the patient that, and now these symptoms that you are having are related to this diagnosis.
Okay.
Are you getting?
All right.
Am I explaining
Yes.
it properly?
Yeah, you are. I got it.
For
I'm not
example, the
sure.
PMS
Yeah.
scenario that you were doing right now, the thing is that the patient will tell you a story, right? And the story will be the patient will be stressed. There will be some sort of trigger in the history. If you successfully dig it out, then when you are addressing the diagnosis, then you have to tell the patient that you are stressed. That is why you are stressed at work. and this is why you're having these PMS symptoms. So in order to address PMS, we have to start with how to address your stress. There are several ways that we can help you with. So if you don't successfully dig out what are the issues, then
But
when you are talking about the management,
Mhm.
so the management can be very, very general.
Yeah, that's true because like when a person has PMS, by person I mean woman, when they have PMS, there is no trigger except that they're about to
So
have
if
their
you look at the
period.
NHS website, there will be something. So because Plab 2 is a very easy exam, most
Yeah.
of the time we miss
Don't say
something in
that.
the history.
Don't say that.
I'm
It's
telling
not.
you, I know. That is why I'm
Okay.
telling you. Okay.
Yeah, but the thing
So
is that we say it's an easy exam, and then all of us,
it's
like most of
really
us,
very
most
easy
of
to
us
fail as well. If you
don't say
do,
that. Yeah, it is easy to fail. So like saying it's an easy exam, it's good to say it's difficult to pass, but it's an easy exam. Then I guess it makes more sense that everybody would be like,
yes,
all right, it needs
because
to work.
like if
Yeah.
you watch too many things and listen to too many people, that's where it gets confusing, right? So the
True.
simple thing is that the patient that you take history, what is the purpose of taking history? To dig out what are the causes, what are the
True.
issues, what is wrong with the
Yes,
patient.
definitely.
So
Definitely.
before, whether you give the Latin word to the patient or not, it doesn't matter, right?
Mm.
What matters to the patient that you tell the patient what are the issues and how the issues are connected with the diagnosis, and now I'm going to address it. That is how you will get better.
Okay. All right.
So the
Thank you,
best,
Dr. Rashid.
sorry, I can
Yeah.
keep on going, but I need to
Okay.
shut up.
Okay. No. That's all right. That's all right. No. I talk a lot too. That's okay.
Yes, yes,
Okay.
but
So
the thing is that actually, if you go through all these steps, then it is like everything is very clear to you. History,
okay.
management,
Mhm,
and the
mhm,
management should be all the
mhm.
issues. If you dig out successfully what are the issues of the patient, then it will be very easy for you to address. Because if you look at the management of PMS, there are several steps that can be taken.
Mhm.
For example, you can offer contraceptive medicine to the patient as well.
Yeah, but I think she did
But
good.
if
She
there,
started with also the senior, talking about the lifestyle.
no, no,
She did not
actually,
say
she did
contraceptive.
perfectly well.
Mhm.
I'm
Okay.
not objecting how she
No.
performed,
I'm
but
sure. I'm sure.
generally,
I'm sure. Okay.
generally, what the PMS scenario would be like, that is what I think.
Okay. All right, Dr. Rashid. Anybody else who wants to do this? Because if not, I'd want someone to be the patient for me. Yes, follow the structure. That's true, Dr. Mariam Saleh. Dr. Mariam, do you want to practice? I do say we're going to do it regularly, but then I have my work and some other things, so we don't do it regularly, even though I want to. Anybody who's interested. If not, then can anybody be the patient for me? Is there anyone? Okay.
Sorry, doctor. I will do, but after a while because I'm just on outside on the road. Okay.
Okay, no worries, no worries, no worries, no worries. Thank you so much, Dr. Mariam. This is a very good advice that there is, the advice is always don't be restricted, follow the structure. Very right, Dr. Mariam. Thank you so much. Right, so anybody who wants to be my patient and have any of the headaches? Anybody at all?
I
Dr.
can be the
Rex,
patient.
Dr. Okay, all right, Dr. Rashid, awesome.
So you are FY2 in general medicine,
Mhm.
and Miss Maria, 55-year-old, came to the hospital with a headache. Take a
So
focused
I'm
history.
at what? I'm where? Sorry, where am I?
General medicine, FY2
Okay,
in general medicine.
okay. How old is
Miss
the patient?
Maria, 55.
Maria. Okay, all right. And she has headache, obviously. Okay, sure thing, Dr. Arshad. Whenever you're ready, we can start.
I'm ready.
Okay, all right. Good morning. This is Dr. Hafsa, one of the junior doctors here in the medicine department. Is this Maria?
Yes, doctor.
All right, Maria, can you please confirm your full name and your date of birth for me?
My name is Maria. I'm 55 years old.
All right, Maria. So what brought you here today? How may I help you?
Doctor, I'm having a headache.
Oh, I'm sorry to hear that. Must be distressful. So can you tell me a little bit more?
So, like what, doctor?
Are you comfortable to go on? May I ask you some questions regarding it?
Yes, doctor, I'm fine. You can ask me.
Okay. Can you tell me where exactly is this headache?
So I'm pointing towards the left temporal area.
Okay. All right. And can you tell me when did it start?
It started 10 days ago.
10 days ago. All right. And like it started 10 days ago. Does it mean like it's getting worse because you came in today?
Like it is there, it is not getting better. I thought it would get better.
Okay. All right. That's a well thing you did by coming here. Well, does this headache go anywhere?
No, doctor.
It's just there. Okay. And is there anything else apart from this headache that I might know of?
No, doctor. I feel like I cannot think because of the headache. It has affected my daily routine a
Okay,
lot.
I'm so sorry to hear that. It's been 10 days inspecting your routine. What do you do, Maria?
I'm a housewife.
You're a housewife. All right. Okay. And Maria, so you said that it's on your temple, and are you having pain at the moment, right now?
Yes, doctor. It is
Okay.
there.
Okay. And is there anything that makes this pain better?
No, doctor. Nothing is helping.
Okay. And anything that makes it worse?
Yes, like pain increases when I touch it. And yesterday and the day before that, I was combing my hair, and the pain got actually worse.
Okay, I'm sorry to hear that. Thank you for sharing that. That's a vital piece of information for me. Well, Maria, apart from the pain that you have on your temple, and you said that you touch it and you had the pain, are you having any visual problems, like any double vision, or at any point you lost it?
No, doctor.
Okay, and are you having any shoulder stiffness or any pain in the shoulders?
No, doctor.
Okay, all right. And have you ever had this before, Maria?
Uh, no, doctor.
Okay, so this is the first time. All right. And are you, Maria, or have you ever been diagnosed with any medical conditions,
Uh, no, doctor.
like any hypertension, etc.?
No,
No?
doctor. Nope.
Okay. Any medication you take, any over-the-counter drugs?
No.
Okay. Anything that you're allergic to?
No, doctor.
Okay. All right, Maria. And Maria, do you smoke?
Yes, doctor. I smoke like 10 cigarettes per day.
Okay. And how long has that been for?
I've been smoking since I was in high school.
Okay. All right. I'm sorry, I would have to go back to the pain. Can you grade this pain for me on a scale of 1 to 2, 10 being the worst and 1 being the least?
So it is 7.
7. All right, that's bad. So don't worry, I'm going to keep it quick so that we could manage you as quick as I can. Thank you so much for answering all the questions, Maria. Well, Maria, now I'd want to examine you. Would that be all right?
Yes, doctor.
Okay, so I'm going to check your vitals, right? I'll be checking your pulse. I'll be checking your blood pressure, your oxygen saturation. I'd also be checking your temperature. Apart from that, I'll be doing some eye exam with this fundoscope, and I'll be checking your nerves. Would that be all right?
Yes, doctor.
All right. Okay, so Maria, thank you so much for sharing all the information that you shared with me.
Examination is
As far
normal,
as examination is
and the
normal.
patient has tender temporal area when you touch
Okay.
it.
Okay. All right, Maria, thank you so much for sharing all the information. You told me that you had a headache that you had for 10 days and that, it gets worse when you touch your temple, and that, you also noticed that when you were combing your head, you had this headache, and, it kind of hurt you. When I did your examination, Maria, you also, cried out of pain when I touched your temple. So from all that we've done, what I think that you might have is a condition related to your head, right? Sometimes there are arthritis arteries in the head, where the cells that are supposed to take care of the infections in the body at times, they start affecting and attacking our own vessels, right? And this condition is called as giant cell arteritis. Have you ever heard of that before, Maria?
No, doctor.
Okay, but did you follow what I said?
Yes, doctor.
Okay, that is great. So Maria, there are certain things that we can do to help you, right? At the moment, I'd want to admit you. Would that be okay? Are you comfortable with that?
And doctor, I have my children at home. I am worried about them. If I get admitted, who will take care of
Is there,
them?
okay, is there anyone at home that you can call and they can help you with it?
No, doctor. I live alone with
Okay,
my children.
okay, all right, don't worry. We try and work something out for that. But at the moment, I'd want to admit you if that's all right. And I'd also be
Doctor, are you
referring.
sure it is this giant cell arteritis?
Well, Maria, at the moment, what you've said, all of this points toward it, because you said that you just had this pain, and when I did your examination, I did not notice any fever and no rashes, and I forgot to ask if you've lost any weight, but because it's been around 10 days, you didn't mention anything else. So as far as this is concerned, it seems like it is this, but I'd be involved with my senior, would talk to him, and if there is anything else, I'd let you know. But as far as right now is concerned, if it's all right, I'd want to admit you, because we'd be running more blood tests, and we'd want to start you on pain medications right away. Are you following me, Maria?
Uh, yes, doctor.
Okay, if it's all right, we'd also be referring you to an ophthalmologist who would later on be doing some further tests, right? Maybe do the ultrasound of your temple artery. And right now, would that be okay with you?
Yes, doctor.
Right, and I'd be also starting, would now want to start you on high dose steroids, right? So we'd be starting you on a high dose, and then we'd be tapering it off in 2 weeks. Are you following me, Maria?
Yes, doctor.
Right? And apart from that, because we're going to give you steroids, there are some side effects associated with it. You could have some mood changes, maybe some weight gain, and high blood pressure. And any of that happens once the time's up. And I think I forgot to ask about floss and everything
I don't
else.
know, like you are doing so well, right? And then you like talk about flaws, etc.
Yeah.
These are the
I want to ask a
things.
question. Why did you say it's temporal? Why did you say it's at GCA?
So then, so yes, it is an important question. Can you answer it, doctor?
Why did I say it was GCA? Because
And
the
the patient
person
gave you
said
a
it
chance
was,
as well. The patient told you that what makes you sure.
yeah, because the patient said that that they had a problem when they were
How do you
combing
confirm
their hair.
giant cell arteritis?
It is, right? It is
It,
GCA,
it
no?
no, so it was, but the thing is that you, I don't know why you did these things, right? Initially, you were going very well. You
What did I do?
cover.
I'm worried. Yes.
So yes, in the
Okay.
management part,
Mhm,
you were supposed to say that you are having a headache, and
mhm,
when I touched it,
yeah,
it was tender, right?
mhm,
But in
yeah.
the examination, like so in the exam, you have to say specific, you have to verbalize examination. If you don't verbalize examination, the examiner would not give you the laminated paper, right? On
So
which
what
there
you're
will be
saying is that
examinations.
I
You
did
didn't
not say
ask
that
for
when I
blood
touched it, it was
investigations.
tender. Okay. All right. Okay. Okay.
So if
So
you had
what you're
asked
trying to
for
say is
blood
that you did not
investigations,
say that.
the patient would tell him, and the patient would give you raised ESR, raised CRP. Then when the patient would, like if the patient asks you that what makes you so sure that it's temporal arteritis, but because if you think about it logically and in real life, is history enough to diagnose giant cell arteritis? Because
You're
you
very
have
right.
to do ultrasound guided biopsy of the temporal artery in order to be absolutely sure.
Mhm.
right?
But we
So
can wait till then, right?
yes, so you have, the thing is that if you had asked for blood investigations, I would have told you
Yes,
that
sir.
the ESR CRP is
Very
raised
good.
as well. Then you were supposed to say,
Very
if the patient has asked you that why do you think that I'm having temporal arteritis, you would have pointed to the raised ESR and CRP and the tenderness in your head. It
Mm.
points towards temporal arteritis. But then you were supposed to say, being a safe doctor, that in order to be sure, we need to do further tests as well.
Yeah, I think I did say that. But you're
But
very right to not do the ESR and the CBC.
so when the
that's
real exam, if
very-
you don't ask for a specific thing, for example, blood
they wouldn't.
investigations, they won't give it to you, right?
That's
And
okay.
the other part is that you asked in the past medical history that, oh, I forgot to ask you about the scale of pain. You jumped to the active complaint. That will
Yeah,
make you unorganized. The logical
that's
order
true.
of everything is
But I
that you
forgot.
are supposed to. So in the real exam, you will forget it. But
Yeah.
if you jump from past medical history to active complaint, they will negatively mark you and they will point
Should I
to your
just skip it?
consultation. You just skip
Should
it.
I just skip it?
Yes,
Okay.
because what is the enemy of perfection?
Hmm. I
Sorry,
don't
what is
know.
the enemy of good?
Bad.
No, the enemy of good is perfection.
Okay. I didn't know that.
You will know a lot of things once you go into the exam.
Okay.
You will
Okay.
like, because your preparation is so good, but I can see that you are like applying a lot of things from different academies, right? So
I just
the
took
thing,
one academy that I haven't even done more. I'm just learning through these sessions.
yes, you no, actually, this is what everybody's doing.
Right.
You are reading everything that you are getting, and you're forgetting yourself that because you are also a doctor. So in the exam,
Which is not a
if you go
perspective
through
there,
the do's and
yeah.
don'ts very carefully, they've written very, very clearly that the examiners can point it out when you are natural and when you are not unnatural, like when you are unnatural and when you are natural. So trust in yourself, your core confidence level should be enough, right? And stay organized in the consultation. There's a shape, universally accepted shape of consultation, that begins with introduction, and after introduction you have to explore the symptoms
We are
in
not
between.
experts. Dr. Asmal, none of us is expert. I don't know about Dr. Arshad, but I am the expert,
I
right?
know
I'm
a bit,
learning.
some more things, right, from
Yeah, that's
experience.
good.
That is why
Inshallah.
I'm sharing it with you.
Are you a repeater, Dr. Arshad, if it's all right to ask?
Yes, sorry to say.
Okay, all right. That's great. That's awesome. So Dr. Arshad
Yes.
is the expert here, I guess.
Yes,
Okay.
so I have a lot of ideas, and I read
Thank
too
you.
many
Welcome
things.
aboard. Yeah.
Yes, I read too many things, but the thing is that